listeners, Harika here, and I'm super excited to welcome you to UppTalk. If you're ready to learn and get your hands work wonders in the world of information technology, then you're in the right place. When I say UppTalk, we are not just another edtech company. Consider we are your learning partner committed to unlocking your full potential. Whether you're stepping into the world of technology for the first time or looking to advance your career, we provide top-tier, hands-on courses to build up your career. Let's take our first step towards learning here and explore it.
Yes, and in today's session, we will talk about healthcare plan. Healthcare plan is quite healthcare insurance and mirror image, but slight, complex, and other plans. And we need to get healthcare right. We will create healthcare plan. Again, healthcare are different types based on the flat rate or calculated rate or percentage. Let's go with flat rate. I will show the new things. What you're going to see here is this coverage details, and then the benefit rates and eligibility. Benefit rates and eligibility. We will discuss in detail, but before that, do remember, we discussed about coverage targets, insurance, and healthcare coverage targets. Right? We're going to use that one. If you're not, if you didn't remember, I'm happy to configure again. But you remember right. If you want to touch it again, you can quickly just touch it. You have complete flow of the steps for healthcare plan to choose. To create healthcare plan, first thing we need healthcare. Coverage targets, which means only employee plus post, employee plus child, employee plus post plus child plus parents or family. These are all coverage targets. After that, you need to create healthcare rates. Healthcare. If only employee is enrolled, what is the employer? Employee contribution. If employee plus spouse is enrolled, what is the employee-employer contribution? Is it a pre-tax or post-tax? These we will discuss under healthcare rates. Healthcare rates. And we will have different types of rates. Different types of rates in the sense one is a flat rate, calculated rate, multiplied by compensation. In today's session, first we will focus on flat rate. And then next I'll pick up calculated rate. How it calculates is based on your base pay or based on a combination of two compensation elements from compensation. Or it can be a flat rate, something like that. First we will proceed to create healthcare coverage targets. Practice the task. Healthcare coverage targets. You can say maintain healthcare coverage targets. This one we created. If you remember, these are relationship types: employee, family, domestic partner. How many mean and maximum we can enroll? What are the load dependent types? What are the required whether enrollment is mandatory? We are given all these details. What is the coverage? Target overall family usage counted in active. Do you remember this one? Yes, right, fine. Let's go with the same. We created aim and D for insurance coverage target. Similarly, the next one is we will create healthcare targets. Healthcare. Not coverage targets or healthcare rates. Let me give a scenario that, based on that, we create. Create new healthcare rates. For salaried employees. Create healthcare rates for salaried employees and ensure the cost breakdown. As per the table, I will tell you. You can go to your tenant, access the task, create healthcare rate. Create healthcare rate. Healthcare rate is nothing, but it will allow you to view the existing one. Whatever the values of flat rate percentage of salaried, these are calculated. Whatever the one you already created, it will allow you to see the rates. You can reuse the rates as well for any other panel, something like this. Let's create our own healthcare rate for our session. I'm also looking into my document. We have healthcare rate. Effective. I'm going to give 112023. We will give healthcare. Rate is AMD. What name will you salaried? Healthcare. Method of rate calculation. I'm searching flat. We will also talk about percentage of salary as well. First of all, flat amount. Demographic factors. Flat amount. Would you like to differentiate the flat amount based on the years? Based on the year's employee age? Or based on the length of the service in months? Or based on the salary? Or none of the above? What does it mean is the healthcare rate will be different based on employee age. The employee is keep increasing. The rate will be keep increasing. The rate will be keep increasing. Sometimes what happened? Based on the length of service, the employee healthcare rate may be increased. Based on the years of service of the employee, or the healthcare rate can be based on the salary. What I'm trying to say here is, let me give some examples practical that we will talk about. For example, I have an option to give the rates if I talk about age. Let's talk about aging years. Let's say employee who's ever aged between 20 to 30, they may have the healthcare rate is $50. Employee, if the employee health is 35 to 40, they may have the healthcare rate is 40 to 50. from turn to third. Something like that. Correct. I'm just selecting some random numbers. Random numbers. 40. Here the amounts will be different based on the age. Correct, sir. Similarly, years of service means if the employee completed 12 months or 24 months or 36 months, the amount will be different. We will talk about all these. First, I want to go basic one, then salary. If an employee's salary is between $5,000 to $1,000 base pay, this is the number of 10 US dollars to 5,000 US dollars. This is the number. We have such a requirement. You may choose this salary. Now let's go with the basic. As I said, none of the above. None of the above. We'll talk about each and all because health and insurance is massive, massive subject. Now tobacco use. This is a flat. Why it is required is if any employee is consuming tobacco, then the health care rate might be slight change for this person. It's a kind of a flag. I enter. Healthcare rate I have given for now is selected flat amount, not percentage of salary, not percent of salary with flat amount. I just a flat amount I have chosen and then none of the above. We will land here. You can enter the description. It is optional. You can enter the description like who are all you would like to ask on this plan. Something like that. You can give it here. Then rate. What is the frequency? This amount, the rate, healthcare rates deducted. On what frequency? According to the customer requirement, yearly or hourly or manually, sorry, monthly. You can select some, choosing monthly by default. Then, based on the country you are implementing, you can select this currency. You can select this currency. Now here you have coverage targets. These ones, what is these? These are called healthcare coverage targets. This one, sir. These targets we are calling into healthcare rates. Let's say employee plus spouse, employee only, employee plus children. We'll select these two, right? Or sometimes employee plus child. Employee plus child is employee only employees plus spouse plus children. Employee plus spouse. If you see, here we don't have an option called employee plus children. Employee plus children is not there. Let's create one for that. We are going to get one healthcare coverage target. We can ask the task to maintain healthcare coverage targets. I'll add one row. Let me show the order is 1. What we'll do? Employee plus children. Minimum count 1, maximum load is 2. We'll add the row. Children or son or daughter, or you can select child. Oh, our values are here. 6. The same field should come here. We'll select employee plus children, employee only, employee plus spouse plus children. Let's call it as a family, or you can select this or you can choose this. Spouse, employee plus spouse. Here we have employee plus child is there. Then we have employee plus spouse. We have then after employee plus family, we have then employee plus employee. Only is also here. Let's scroll down. Once you select next page, you have red bands. Select these red bands. Now here, enter the red bands according to the requirement. What first will go with employee plus child? Healthcare right. It is a pre-tax. Let's say if employee plus child is enrolling, we will give flat amount $135. Employee plus child $30. Then employee plus domestic partner, I mean spouse, we will get $145. Then after employee. Anyway, we are just doing practice. Usually, employee plus spouse will be cheaper than plus children. Oh, is it? I put that there. We're just doing random. Let's go ahead. Let's put that at 1. Let's say 125 plus spouse 125. And then who else? Only 95. $95. Then after employee plus family, you put in some charge. Employee plus family. That's 1.5. Now just use the alphabetical figures anyway. This is our red side. We have post-tax, pre-tax. Make sure we enter in the right one. These are the employee amounts. Employer cost also we can give here non-taxable. Any random amount you want to tell, sir. Or shall I give something? Random. Employee plus our 2d6. No, you are changing. They should be very careful. Actually, I'm looking into my notes and entering the data here, the value. Employee plus family, how much will you give? 320 will give. Multiply. Then employee plus house 225 will give. Then employee only will give her 20. This is your clear right, sir. Box. Fantastic. Now we do have benefit surcharge, some additional charges for the benefit provider. If you would like to. I mean surcharge is pretty straightforward on creating. For now, what I do is I will select existing surcharges and tomorrow we will pick up the credits and surcharges as well. Employee plus family, employees plus spouse, we will see. If employee, undolling employee plus family some surcharge originally they would like to pay. What a GMS? GMS spouse surcharge something. We'll give the 30. That's not required. Here only amount will be there. Credits and this one again. I will explain in detail. This field. We have created our healthcare rate. Healthcare rate plans. Any questions are here. The benefits surcharge. Is it compulsory or it's optional? If the requirements, if they don't have a surcharge, which will be left empty, right? Yes, if they don't have surcharge, we can left empty, but we can create if surcharge is applicable from the provider. You can select create surcharge here and enter the date. What is the surcharge type? Based on tobacco surcharge or spousal surcharge, and you can give the surcharge name here. Some additional costs, since they're unrolling into the spouse, some the 20-30 extra. But I think most of the time they anyway the surcharge. I've always seen it more like for tobacco users that they get a surcharge. Not sure why they don't include alcohol. They'll include only tobacco. They're not the current. Annual surcharge market amount of other deal should be additionally paranormal. Employees pay. Right, sir. Is it clear on the red bands? Here you can get targets. Here you can see rates while creating healthcare targets. If you identify any type of target is not available directly, you can access tasks on maintain healthcare target. You can create them. With this, we'll create our plan. No covers. Again, we need to start from scratch. Maintain benefit coverage. What are you here? You'll be at the medical. I'll go with the one. I'll go to the AMD, sir. Let us go. While you do practice, you can do BRT. It is easy to figure it out. Perfect. The medical classification. Let's select visionary. Wait. I count which one you want, sir. Such classification did we discuss in the last session. While you're talking about basics, I will still pick up. These are quite common. You are aware there's no big difference for this, but I will select it as only additional thing is medicals and flex grades can be applied or not. It's such again. I'll pick up into my session. I'm saving this record. Let's go ahead. We benefit. Effective date. For a while, we will select my life if it exists well. And plan type. Healthcare. I'll create a few options of the calculated one. Covers target type we selected and the medical. Classifications you can enter. Benefit plan. If you don't give the plan answer, you know right, it will pick up MetLife. MetLife AMD Medical. AMD Medical. I will remove this one coverage type. Let me do. Then on that classification, we can, if we have the HMO, if we also have the, you can take two or more, or only one can be selected. Right. What happens here is when you select three over their healthcare coverage types, you can create three different types of medical plans. For HMOP, POVSP with the same coverage type, we'll create different plans. We are going to create some. This is flat rate, right? Now again, we need to get based on the years, etc. Three plans will create. Plan name I'm not giving you. Let's pick up from the coverage type from the provider. Participating group. This one, customers will provide GPR number, group policy, and all that. Yes, then salary. Active employees. Additional. Oh, dependent eligibility we need to create. You have mentioned here spouse, children. Right? We need to create different eligibility rules. Let's create that. Create benefit eligibility rule. Dependent benefit eligibility rule. The name it as a factored as. It's sort of like painting to the sun off. Select relationship types. There's been no relationship, not I don't know. We will also select. I'm going to select spouse on the right. This will be fine. If not, it's not working with troubleshoot. Anyone, child or spouse are visible. That's what we're saying. Copy the text, paste it here. Overage dependent eligibility. You remember right. If the child is 21 years and about 24 years and above, it should not be eligible for this plan and no longer eligible, right? Also in US, also right. 4. We have We can create, we will this, we will talk. Do you discuss during our passive event rules removing the plan from the children whose age reaches to the 21? I request provider ID. If we select this checkbox, it will ask you to enter provider ID at the time of enrolling into the plan. Auto enroll means automatically the plan will be enrolled. When you choose this option, please do remember you don't have an option to waive off the plan. Right? Automatically. We are saying it's a highly deductible health plan. This is just a flag for the payroll team. This plan is highly deductible. It's a reporting purpose derived coverage targets, which means we already gave the coverage targets based on the data. You can select this option. Then let's also record this. You have to check. No, someone refreshed it. Let me see. Our data is still there. We didn't lose the data. We're staying. Use individual rates because we cannot make it externally. Hence we need to, and chair requires provider ID since we don't have the provider ID. Or we can do that. Then we'll select this on monthly basis. Awnings and direction mapping we will do later. This one's I said yes. Affordable Care Act. I have not worked much on this option, but however, I will provide the notes funding method minimum essential coverage. I will give the details. Now go with explain plan details. You can give the description if required. And here, additionally, you have display order for coverage details. Coverage details. You have a display order. It's purely optional. The same details you can directly maintain on that. Let me do this. I will show the comparison. Kindly hold these three. I will walk through tomorrow because healthcare we're going to talk about 4 sessions. Benefits, rates and healthcare. The benefit group we already selected plan. The same one will be available here. Active employee salary. And this is the employee domestic partner member. Everything will be defaulted based on this. Please remove the values whichever you think are not applicable. But how come it should be default the values? Why it is not default? You got my point, sir. What I'm saying, but is this our whole? I thought this is. Total session thing. Healthcare. What mistake I have did here? What I'm saying here is it should. It should bring the values in which we have given healthcare rates. Cancel this. I just changed the calculator list because it should ask us to enter. Healthcare rate. Here we go. Sorry, sir. There's a correction. I choose in the flat rate. That's the reason it doesn't give. It is asking you to enter. When I switch the calculated rate, automatically, what are the logic? We already given the healthcare rate here. I have an option to select like this one, the one we created. One correction from my side. I supposed to select calculated rate. I selected flat rate. That's the reason we're not. We didn't see that. It clears up what you're talking about. I'm still looking, even with that, for that of the healthcare flat rate. Rather, they didn't pull the rate we created before. We can see our whole reach. Right. Let me tell this. When you go with the flat rate, right, it doesn't bring the healthcare rate which we created. Bring this one. You need to enter the values directly on the plan, level option 1. We have chosen. Let's default the rates from the healthcare rate. If you go with that option, I must switch to calculation, not the flat one. It's my bad. I selected a flat one. How did I confuse you, or you got the point? I will tell you something. There are two things. While you're getting plumb flat rate, another one is if you choose flat rate, all the healthcare coverage our gets will be defaulted and you need to enter values for each coverage, each target. If you go with calculated, the healthcare rate you created will be defaulted. I selected spouse employee plus children employee plus family. These are all right. All these are really defaulted. If you go with this option, everything, what are the coverage targets we have created? Everything will be defaulted. Of course, though it is defaulted, you have an option to remove those targets. Can you do the tax? Create healthcare rates. I want to see something there. We'll do one thing. I'll create this. Then I will create another one with different, since we're classification people. Rest we already discussed. Dependent plan. On the list of eligibility. Also, we created AMD dependent spouse, child, daughter. I dimension not required. There are coverage targets. Scroll down. This I said we will talk here. The benefit group. Start. I'm going to select AMD. Here my healthcare rate and healthcare target rates. Alright, let me try to save this. This is the writing. Now I'm going to get another benefit plan, as I mentioned. No, it's rates that I want to see. I want to check something on that. Do it. Want me to edit the rate which we created. Do just do create our add character. Here are the red bands. No, when we go to the method for rates calculation, method for rate calculation, we chose a that will come or I got it. That will come only if you create a brand new healthcare rate. That's what I'm trying to see. I want to see what the behavior is when we do a brand new healthcare rates and we chose that to be calculated instead of flats. Oh, that time we started flats, but let's calculate it. Right. And then which one will select? Let calculator rates. Flat amount, percentage of salary with flat amount. Now you know. This was where we chose flats amount. Exactly. I understood. The confusion here we're choosing the flat amount. But creating the plan we selected calculated. That's a confusing thing. I agree. But that's how they gave the plan type. Right. Test out plan and then we'll create. Let's just go ahead. Then we'll talk about percentage. Then talk about this. And then also we'll cover this as well. The guests are applied to show the setup is quite newly anchored. Let's create the benefit event in the arc. We will get enrollment event role. And the row. Medical, and this is applicable now since it is a healthcare allowed benefit plan changes. And select any plan. Allow dependent changes. Can add dependents. Additionally, pendants are allowed. What dependent types are allowed? Pause. I think we are missing here. Defining rules. Right. What is the last step? We need to perform some. The last one after that will not be. Plan your definition. Plan your definition. We plan your definition. We'll proceed for testing. We will select. Oh, I'll select. That's how you? I'm not sure. I'm not sure if I'm right. Before that, allow me to cancel the open. Let's cancel. Action. Check. Oh, enroll. Select. Employee 1. Please. This is employee contribution. Most of the time, the employer contribution field. It would be eating. We can do that if you would like. Then we can hide it. No, when I'm through my practice, I will. Adding dependent. Tar- target. Company only. I am enrolling dependent. The system was unable to deliver coverage type. Please contact your benefit administrator. No, because we see that for. employee only. It's not supposed to run us. What's your offer? Dependent because it's for 9 to 5, which is for employee only. But our plan also. We're allowing to enroll spouse, child, and other people. Also correct family. No, I got this one. Coverage currently applicable only for employee. Definitely true. Correct. But I also would like to enroll the spouse. But when I select, I am getting this error. The first. If it is the only employee, 100% is correct. No issue. We can still proceed. But while certain spouses giving error, I need to travel. I expected this. You got the points. What went wrong? It's a requires to a robot was not checked. Let's fix it. Wherever we can see spouse, we have to see the reference ID. uh, Tick. Which one? Here we go. Now we'll give it a try. I'm canceling this event. the difference. Now I live in before page employee only. If only employee want that, well, you can save it. Now I selected independent. No, it's not. I will tell you why we had an error. Also here we relationship. We are saying spouse, correct? Worker level, but in the healthcare coverage targets. What I did is I selected randomly, not the right value. What can you do? Employee dependent relation plus your eligibility relation plus healthcare rate relation. All three are in, should be in sync. They know it will be applicable. We save it. Very good. Review and sign in. Statement will see. Worker profile also will go or see. It's like a steering progress. Let me check. This cobra. BP is killing us. Boys with this stuff now. It doesn't have cobra. How come cobra is triggering? Now we shouldn't go for corporate. Again, I'm going to repeat. There is an issue with the BP, sir, not with our configuration. This is working, but BP is annoying. Actually bypass the other one, but I will remove the step. But now we'll check the spouse plus dependent. Employee cost, employer cost. Any questions on this? Please do like, share and subscribe to our channel. For more information, contact us sales@uptalk.com.